As for Arlington residents, you might have heard of Cambridge Health Alliance, but do you know that they just received the highest level of national recognition for healthcare? Today we're very happy to have Dr. Elvin and Ms. Robinson to be with us to tell us more about CHA. Could you please introduce yourself?
Thank you for having me today in Arlington. I work at Cambridge Health Alliance. I'm a primary care doctor where I take care of adults and children, and I'm also the president of the medical staff.
My name is Roberta Robinson. I'm Director of Marketing and Outreach for the Geriatric Division of the Cambridge Health Alliance.
Could you please briefly introduce CHA to us as well?
Oh, sure. Well, Cambridge Health Alliance is an alliance of hospitals, Cambridge, Somerville, Whidden Hospital, a dozen primary care centers and specialty centers, and we take care of nearly 200,000 people in Cambridge, Somerville, Malden, Revere, Everett, Chelsea, and Winthrop.
Okay, so currently not Arlington, right?
Well, I say those because those are our primary, what we call catchment areas. But in primary care, we see many people that live in Arlington and Watertown and Lynn and other regions of the Metro Boston area.
What kind of services do you provide?
But our particular focus is on the parts of our population, parts of our communities that are unable to advocate for themselves. It's very difficult to take care of a person with a medical problem and say, okay, take this medication, or you need to have this particular medical test when the person can't go home to a safe environment or doesn't have enough money for food or their just basic welfare. So we work really hard to make sure those patients have transportation or have housing if possible, and the normal staples that you need to have before you even start thinking about some of these general health conditions that we're focused on sometimes as a doctor.
For older adults, we have a state-of-the-art primary health care clinic at Somerville Hospital, and we have several geriatricians on board with the Cambridge Health Alliance. And we have a geriatric services. They are social workers. Locally, we're called Elder Service Plan, and nationally, it's a PACE program of all-inclusive care for the elderly. I know that working with the PACE program, there are people that are alive and they wouldn't necessarily have been alive if they didn't have all of the support system and that whole team to follow them.
Our expertise for the last couple of decades has really been studying how you, as a community-based provider of primary behavioral health and specialty care, how do you work to integrate the system so that you provide a really great care at a population level, so that everybody gets what they need to prevent the problems before they start.